Hi, my name is Linda Warsaw, and today I'm going to talk about implementation of improved bedside shift reporting, an evidence-based practice project proposal. This is for course NUR 3043, Professor Dr. CL, and today's date, January 26, 2025. Okay, let's get started. I'm going to begin with an introduction. Basically, in the fast-paced environment of healthcare, effective communication among healthcare providers is critical for ensuring patient safety and for delivering high-quality care. One area of nursing practice that requires improvement is the traditional method of shift reporting. Current evidence suggests that traditional shift reports, which are often conducted, away from the patient's room, usually at the nurse's station, can lead to communication gaps. It also leads to increased errors and a lack of patient involvement in their care. This evidence-based practice project proposal aims to address the implementation of improved bedside shift reporting, also known as BSR, to enhance communication among healthcare providers and improve patient safety outcomes. The guiding research question today is, how does implementing bedside shift reporting impact patient safety and provider communication compared to traditional shift reporting methods? Okay, we are going to discuss the background and the rationale. First and foremost, the challenges associated with traditional shift reporting. A comprehensive review of this literature highlights the challenges associated with traditional shift reporting. Research indicates that communication breakdowns during handoffs are a significant contributing factor to medical errors. A systematic review by Sand, Jenkin, and Sherman, 2019, demonstrated that BSR, bedside shift reporting, improves communication accuracy, increases patient engagement, because of course the patient is right there and they feel like they are playing an important role in their care and well-being and improvement. Definitely implementing BSR resulted in higher patient satisfaction and fewer adverse events. Despite the evidence, though, despite the evidence, many institutions still rely on outdated reporting methods, citing barriers like time constraints and just a general resistance to change. This gap in practice underscores the need for an intervention that prioritizes the patient-centered care and fosters teamwork among providers. The proposed project is expected to not only improve patient outcomes, but also enhance nurses' confidence and satisfaction by fostering a culture of collaboration and transparency. So now we're going to move on to the methodology, starting with the project objectives. Basically, this project will utilize a quality improvement approach with both a pre and post intervention design. Baseline data on communication errors, patient satisfaction scores, and staff compliance with shift reporting will be collected prior to implementation. Post-intervention data will be collected at 3 and 6 months prior to assess the effectiveness of the intervention. So intervention, basically the objectives are implement bedside shift reporting on a medical surgical unit. We'll call it Hospital X within a 6-month time frame. We'll increase staff compliance with BSR protocols to a 90% within 3 months of implementation and reduce the incidence of communication-related errors of 20% within 6 months. Our goal is also to improve patient satisfaction scores related to communication by 15% within 6 months. Okay, let's move forward. I think I incorporated a chart here, figure 1 and figure 2, kind of to show you about a hospital. Washington Regional Medical Center did a similar study. According to a 2015 study at Washington Regional Medical Center, there was over a 10% improvement in the number of nurses that went into the patient's room after receiving training on BSR. Also, according to the same study, there was also a 5% improvement in communication of important patient information during shift report after BSR training. So it shows that this project will definitely have a good outcome. Okay. I think I kind of jumped the gun earlier, folks, and went into the project approach. This project will utilize a quality improvement approach with a pre and post intervention design. I did mention that earlier. Okay. Intervention or practice change. This intervention involves implementing a standardized BSR protocol. It includes reviewing the patient's current status and care plan at the bedside, involving the patient and family members in the discussion, and using a structured tool such as SBAR, that's situation, background, assessment, and recommendation to ensure consistency. This intervention aligns with evidence-based guidelines, emphasizing patient-centered care and effective communication during handoffs. The implementation plan, number 1, staff training. Conduct mandatory training sessions for nurses on BSR protocols, emphasizing the importance of patient involvement and the use of BSR, or SBAR, I should say. Resource allocation. Provide necessary resources such as a laminated SBAR template to ensure adequate staffing to support transition. Stakeholder engagement. Let's engage those unit leaders, the physicians and the patients, and garner support all the way around to address the concerns. Pilot testing. Initiate a 2-week pilot phase to identify potential challenges and refine the process. And the rollout, full implementation. Let's roll out the protocol process across the medical surge unit with ongoing monitoring and support. And collect feedback and adjustments. Let's collect that feedback from staff, patients to address all the barriers and make the necessary adjustments. Okay, evaluation methods. Evaluation will focus on the impact of the BSR on patient safety, communication, and satisfaction. Data collection methods will include pre and post intervention surveys, measure patient satisfaction and staff perceptions of communication, error reporting, that means track the incidence of communication-related errors. Direct supervision, we will assess the BSR protocols using a checklist. And data analysis, we will use descriptive and interferential statistics to evaluate the changes in outcomes. And ethical considerations, including ensuring confidentiality and obtaining informed consent for participation in the surveys. Okay, expected outcomes and implications. The proposed intervention is expected to improve patient safety by reducing communication-related errors, enhance patient satisfaction through active involvement in care, foster a collaborative work environment involving nurse satisfaction and retention, demonstrate the cost effectiveness of evidence-based practice by potentially reducing adverse events and associated costs. These outcomes align with the broader goals of nursing practice to prioritize patient-centered care and ensure the highest standards of safety and quality. Conclusion. This evidence-based project proposal highlights the importance of bedside shift reporting, which include improving patient safety and communication among healthcare providers, promote a culture of transparency, collaboration, patient-centered care. The anticipated improvements in patient outcomes, staff satisfaction, and healthcare delivery underscore the value of integrating evidence-based interventions into the nursing practice. Through this initiative, folks, we aim to contribute meaningfully to the advancement of nursing practice and the enhancement of patient care. Thank you so much for watching and have a great day.